Hello, this is Dr. P.C. Gupta. I am a vascular surgeon working at Care Hospitals in Hyderabad. Today I will speak to you about aortic dissection. Now, aorta is the main artery which arises from the heart and carries blood to all the organs of the body. When there is a split in the wall of the aorta, we call it aortic dissection. So effectively what happens is, from a single lumen, now you have a double lumen tube through which blood is going. And the outer lumen or the false lumen is weak and tends to increase in size. There are two types of aortic dissection that we are mainly concerned with. Type A, which starts at the level of the heart and involves the aortic valve. This is an emergency and should be treated on urgent basis and requires a combination of open surgery and what we call a frozen elephant trunk. The other is a type B dissection, which starts a little beyond the subclavian artery, which supplies blood to the left hand. This is usually not an emergency, but it is important that the patient is hospitalized, the blood pressure is controlled, because aortic dissection, the major risk factors are increasing age, uncontrolled blood pressure, and there are many genetic syndromes like Marfan's and Lloyd-Dietz which predispose a person to aortic dissection. So control of blood pressure is extremely important. Sometimes there is an emergency when it comes to type B dissection. This happens when blood pressure cannot be controlled, when the size of the aorta is very large, or if some organ is not perfused, for example, blood flow to the kidney is affected, then it becomes an emergency. Otherwise, we like to manage with medication, control the blood pressure, and then treat with stents, perhaps after 2 to 3 weeks. So most important thing when it comes to aortic dissection, if you get pain in the chest, pain in the back, while we often think of a heart attack, it could be an aortic dissection. So when you go to the emergency, let the doctors evaluate. A CT scan is the one test which will always pick up aortic dissection and confirm the diagnosis. So it is important that you and your doctor are aware of aortic dissection. Take good care of blood pressure control and of course stop smoking.